Good afternoon, everybody, and thank you for joining us with another edition of Condo Insider. As most of you might know or may not know, so we have our own new YouTube channel. Think Tech officially retired end of April, so we're continuing on with a new producer who is Ikaika Kimura. So he's in the background there, and we're continuing with the same format of information for condo owners, or even just any owner or any citizen of the US that can view us on YouTube, on our White Council YouTube channel. So I have with me today Candace Nakamoto, who is within the Executive Office of Aging. There's several branches that are within the Executive Office of Aging. One of them is SHIP, and I'm sure some of you might have seen commercials. They use the I know one that comes to mind are the UH coach, volleyball coach, and some other familiar faces. But we're going to talk about the Hawaii SHIP program, and pretty much I think every state has a similar program
Yes.
for Medicare, and it really can help when you're if you for some people they may not have the human resources ability, or they might have that capacity within human resources to guide them along when they're starting to reach that retirement age. I'm just thankful that someone warned me that I had to apply for mine 3 months prior to my 65th birthday. Otherwise, I probably wouldn't have done it. But I mean, they told me there's a penalty if you don't do it, so I made sure I marked it in my calendar. But also SHIP can help you go through some of the insurance policy. Because man, when I got that age, I was being bombarded with junk mail.
hmm
And it was up to yin yang. I was like, oh my God. So I'm going to turn it over to Candace. Thank you, Candace,
Thank you,
for your time.
Raylene.
So take it away.
Well, aloha, everybody. Thank you for allowing me to share some information about the Hawaii SHIP program. As Raylene mentioned, my name is Candace Nakamoto. I am the volunteer coordinator for Hawaii SHIP. No, we aren't a shipping company. SHIP stands for the State Health Insurance Assistance Program. And we are part of the Department of Health Executive Office on Aging, and we are a federally funded volunteer-based program. So I'm going to go ahead and share my screen and then move next. So within the Executive Office on Aging, our program is part of the Advocacy, Education, and Outreach section. We call ourselves AEOS. And our section provides direct services to the community. SHIP has been an established program in Hawaii since 1992. You may have known us under our former name of Sage Plus. You can see our old logo here. In the early 2000s, we were branded to Hawaii SHIP. SHIP also receives a separate additional grant called MIPA. And MIPA helps individuals that have limited income, speak English as a second language, are of Native Hawaiian descent, or are really isolated, apply for financial assistance that can lower their Medicare and other health costs. So SHIP also helps people apply for financial assistance. All right, so before we get into SHIP services, I wanted to highlight just briefly what is Medicare for those that are not familiar. In a nutshell, Medicare is for those who are 65 years and older, so you can qualify by age. If you're under the age of 65, you can receive Medicare through Social Security Disability Insurance, SSDI. If you're on SSDI for 24 consecutive months, you can qualify for Medicare automatically. Or if you have health conditions like end-stage renal disease, kidney disease, or ALS, also known as Lou Gehrig's disease, you can qualify for Medicare at any age. So that's the groups of people that might have Medicare. And then this is a nice visual depiction of the different parts of Medicare and people's options. So you can see that there are different parts, A, B, C, D, Medigap, and they cover different benefits and services. So think of Medicare as two separate rooms or two separate doors. Behind door one would be original Medicare. Some people might call it traditional Medicare. And that consists really of Part A, which is your hospital insurance. It also covers short-term skilled nursing facility care. So maybe after a hospitalization, you're in a rehab facility, it will cover up to 100 days of that short stay. Hospice end-of-life care and home health care are all under Part A. Part B is more of your outpatient doctors, emergency room. Durable medical equipment is like your walkers, your wheelchairs, your canes, and preventive services like flu shots or health screenings. That all falls under Part B. You do have an option to pick up a Part D, a prescription drug plan. If you just have A and B alone, it will not cover all of your medications. So we highly suggest if you want to stick with original Medicare, that you find a separate drug plan. And then not everybody will need a Medigap, but some people that want more coverage that Part A and Part B did not cover, then you might want to consider picking up a Medigap, a Medicare supplement insurance. Usually, original Medicare pays 80% and you pay 20% out of pocket. So if you have a Medigap, depending on your plan, it could pay the remaining 20% out of pocket. So your out of pocket cost is rather low if you have a Medigap plan. So that was door one of your options. Now, door two is your Medicare Advantage. Some people call it a Part C. They are interchangeable. And Part C plans are an alternative option to original Medicare. So they're going to cover the exact same things as original Medicare and more because the Medicare Advantage market is competitive. So they are going to be offering you things like vision, dental, hearing, gym memberships. These are the other perks that come with Medicare Advantage plans. In order to get a Advantage plan, you must first have to have Part A and Part B. And the Advantage plans, for the most part, include prescription drug coverage. Around 90% of the plans bundle that drug coverage into the plan, so you don't have to find a separate drug plan. You might be familiar with some of these names of these insurance companies: HMSA, Kaiser, United Healthcare, Humana, WellCare by Ohana, or Devoted Health. So these are some of the insurers who sell Medicare Advantage plans in Hawaii. But there is no cookie cutter coverage. There's benefits and negatives of both options. Medicare is unique to the individual. So basically, SHIP can help people better understand their choices and what makes more sense for them. So why would a person want to contact Hawaii SHIP? Well, last year, Hawaii SHIP assisted over 9,000 Medicare beneficiaries through counseling, presentations, and outreach events. So some of these questions you see on the screen are the ones that we get asked from the public. So maybe they're turning 65 and they're wondering if they need to sign up for Medicare. They're not sure what they need to do. Or they need help paying for their medications or their premiums. They want to compare different plan options because there's a lot of choices out there. Or maybe they're just confused about their coverage and they don't know what they have. If this sounds familiar or you know of someone that in that situation, then they could potentially use Hawaii SHIP services. So one of our most popular services is counseling. So SHIP can help you, a friend, or a loved one, basically anybody who needs that advice can call into our helpline and get counseling assistance. Our volunteers are trained to counsel people and provide free, local, timely, and unbiased information. So what sets SHIP apart is that we don't sell insurance. So we have no incentive to guide somebody one choice or the other, and we're not affiliated with any of the health insurance plans. We just are here to kind of give that general information and education and empower people to make their own healthcare decisions. So a person can call our helpline. You can see on the screen. At the end, we'll give you the helpline, but it's 808-586-7299, or you can go to our website at hawaiiship.org and you can leave a contact or a detailed message. Typically, we want to know what is your name, your zip code, telephone number, best time to reach you, and why you're calling. The more detailed message you can leave, the better prepared the counselor will be when they call you back. Our policy is to call clients back within less than 5 business days. Usually within a day or two, you'll get a call back. Our secretary is pulling the calls from our helpline every day. Most of the counseling is conducted over the phone, but in-person appointments can be arranged at our office in the EOA office or a partner site if it's on the neighbor islands. Hawaii Ship is partnering this year with AARP. We're going to be hosting open enrollment presentations and counseling statewide. So we're going to be doing that in October. So we'll be posting that event information once everything is settled on our website, and you can register to attend. Right. Another popular service is plan comparisons. Because as Relaine mentioned, there's a lot of different options. People get a lot of mailers and they're confused about which plan is best for them, what they should do. And so the really busy season for Medicare is during open enrollment, which occurs October 15th to December 7th. This is like our Super Bowl time where we get really, really busy. And this is because everybody on Medicare can make a change to their coverage. So people are kind of assessing, is this really the best plan for me, or is there something better out there? So we actually train some of our volunteers to be plan comparison specialists, and they look at your medications, your pharmacies that you want to go to, if you want to compare Advantage plans, drug plans, or Medigap plans. And they're going to highlight the 3 most cost-effective plan options according to what you're looking for in a plan. Do you have a preference in insurance company? Do you really want to make sure that that plan covers that specific service? We take into consideration all of that information and then provide a cover letter explaining what we did. We do a side-by-side comparison of your different plan options, and then details for each plan option and what it costs and what it covers. So that kind of helps people narrow down all of their different plan options. Everything is getting more expensive nowadays, and we know that health insurance is no exception. Things are very expensive. So all of the counselors are actually trained to screen beneficiaries' income and assets, just a general screening to see if they might be eligible to save some money on their Medicare premiums and costs. So we kind of say, do you think your income is above or below the specific number? And if it's below that amount, then they might qualify for Medicaid, which is basically the highest level of financial assistance you can get. It acts as almost like another health insurance, or they can qualify for the Medicare Savings Program. MSP helps to pay your premiums and some of the deductibles and copays, or Extra Help, which helps just for your prescription drugs. So it will pay for your premiums or your out-of-pocket cost. So if a person appears to be eligible below those numbers, then the volunteer specialist can direct them on where to apply, either with DHS or Social Security. If they really don't know how to apply for themselves, we actually have specialists who help them complete the application and submit it on behalf of the client. We really encourage people to apply for these financial assistance programs because there's no limit to how many times you can apply. And the worst thing is you get denied because you make too much money. You can always reapply if your situation changes, but our volunteers screen everybody for eligibility. I did want to do a quick plug. We do offer presentations for the public, similar to this one. We have volunteer presenters statewide, and we have around 16 different types of presentations on various Medicare-related topics. Some of our highly requested presentations are like Medicare basics, We have durable medical equipment presentations, Medicare notices, and a lot more. We actually are hosting a well-known presentation called Project Grad 65. And this is in partnership with the Social Security Administration. It will be held on August 19th, so that's next week, Monday, from 10 to 12. Social Security will be providing information from 10 to 11, and then we're going to do Medicare Basics from 11 to 12. So this presentation kind of was created to welcome people who are turning 65 into the very confusing world of Medicare and Social Security. It's like a 101 rundown for folks. And this is a very popular presentation that we offer. We, on average, get over 100 attendees that register, so it gets pretty filled up. So we recommend registering as soon as possible. On our website on hawaiiship.org, there is a pop-up flyer with the registration link. You'll also get a copy of today's slides, and the link is there to register as well. If the date and time do not work with your schedule because you're working, we plan on offering Project Grad presentations during the weekday at night next year, so those can kind of tune in after work. We are also doing fairs and exhibits, so you might see us at community events. Our friendly volunteers will be in a bright aqua blue shirt. You can stop by our booth and say hi to them. They want to share Medicare information with you, so we have our brochures, we have literature, and a lot of times people have questions, specific questions about Medicare that they can address at that time. So we'll be kind of participating in community events statewide. Okay, just to cover a few client testimonials with you to get a feel of the impact that the volunteers make. I'm going to share a few cases with you. SHIP volunteers touch the lives of a lot of Hawaii residents. And the first case of Medicare premiums, a woman heard about the SHIP program through her local senior center. It was Lanakila. She initially called about setting up automatic payments for her Medicare premiums, but she was having difficulties setting that program up. So she spoke to a volunteer about her Medicare, and the volunteer actually discovered that she was not paying her premiums because she was making overpayments. So Medicare was not collecting the money because it was too much money. So the SHIP volunteer had to call Medicare to confirm that. She was actually 1 month away from having her Medicare canceled due to non-payment, and she was unaware because she was cutting the checks, and she assumed Medicare was cashing them. By the end of the call, we were able to help her get caught up on those back payments that she owed Medicare. And once she was caught up on those back payments, we set her up with the automatic payments that connect to her bank account, so she doesn't have to worry about writing checks every month to pay Medicare. Another case was a SHIP volunteer helped a woman on Hawaii Island who had a rare disease and she needed a lot of medications. One of her medications that she took cost more than $300,000. So for one drug, $300,000. And the counselor was able to research different plan options and drug assistance programs through the manufacturer. And they helped this woman switch her drug coverage. And this decreased the woman's drug cost from $300,000 to just $10,000 for all of her drugs per year. So just by doing a simple assessment of different plan options, they were able to decrease the amount she owed. And some testimonials, people are very thankful for the service and they're appreciative of us calling them back and trying our best to help resolve their questions. I spoke a little bit about the Hawaii SHIP website today. Resources are just one click away. Hawaii SHIP, we created a user-friendly website with a lot of resources, and they're in multi-languages as well. So we listed some of the languages that we offer materials in. We also do blog posts. So if there's an announcement from Medicare or national, we post blogs about it. And we're also on social media. So we have a YouTube page where we have videos. We have a Facebook account as well as a Twitter account. And we post like helpful information or updates there as well. And then there is also on the next page. Oh, sorry. It's still on this page. There's a toolkit. So sometimes SHIP gets calls about, like, for example, non-Medicare related issues. So you can see here we have a partner resource guide, and we have different programs and services available for other issues non-related to Medicare. But we do have a network of partners that we work with and refer to if it's not directly related to Medicare related questions. For example, we're partnered with the Triple A's. You can see here Catholic Charities, Project Donna. So connecting the kupuna with resources, doing warm handoffs and referrals, we often try to connect the kupuna with the correct resource and get them the services that they need. So if you, a friend or a loved one, have any Medicare related issues, you can always contact us. And this is the helpline information for Oahu. We have a toll-free number as well as our website. At this time, if you guys have any questions, I'd be happy to answer any questions that you might have. Thank you.
Had one question.
Sure.
So, now I have to rethink what I was going to ask you. So the plans, so you basically could help anybody search through the plans that are available and guide them into the right, or at least explain to them. Because I know sometimes everybody goes, can you just explain to me? Because there's so much reading to do. And, it kind of like gets all mumble jumbled in your head sometimes because you're like, it's too much information. Give me the Cliff Note version, so that they can make a decision. And one thing I wanted, because this is a lot we're dealing with, a lot of condo owners, and a lot of seniors have gone from their single family house. They've now gone downsized into condos. But with that comes another issue is the cost of rising maintenance fees. So, and that's where some buildings have, the condo boards have said, we don't want to raise maintenance fees because now we have these seniors on fixed income. They're not going to be able to afford it. But still, you can't delay your operating expenses because you're really looking after the seniors. You can commend them for it, but you still can't. You still have to repair the roof.
Right.
So one option I was thinking of was going to SHIP and have SHIP evaluated that seniors to see where they can come up with other avenues that the seniors can use that's available, all the resources that can hopefully bring down their Medicare costs. Because they might qualify for that Medicaid. Was it correct? They might qualify for some of those other programs. Even the prescription drug programs. I know Sam's does a really good job of bringing down the cost of prescription drugs. They do a really good job.
If they don't qualify for the Medicaid, the Medicare Savings Program, or the Extra Help, we do have a prescription drug assistance list of programs like that Sam's Club or Good RX or the AARP programs that can just save them money on their prescription medications.
Yeah, and I think sometimes the cost will vary depending on the pharmacy as well.
Yep.
Because I remember one time for whatever reason, I went to Walgreens, filled a prescription, and it was like, they told me how much it was. I was like, God, I don't remember paying that much at Sam's. I have to go home and look. And so I called Sam's. I go, what is my cost? It was a major difference.
Oh,
it
yeah.
was comparing your 300,000 to the 10,000. I mean, it was a huge difference. So even the differences in pharmacies can bring your prescriptions down.
Even if it's to like Long's or CVS, if it's in different locations, there's different costs associated. So
wow.
Yeah.
Wow. Yeah, because my husband had asthma, so he would have the albuterol things. Oh my God. And before we only had Longs, right? But what I noticed when Walgreens came in, oh no, Walmart came in, the prices came down. I mean, I refilled that prescription at Longs in a long time. Because it was like, oh my God, are we going to eat tomorrow?
It's cheaper. Yeah.
Yeah, it was incredible. Okay. So I really want to thank you for doing this, and I really encourage the condo owners to reach out if they're on if they're retired, fixed incomes, to reach out to see where they can qualify for some of these programs. And I know one of the things some people kind of get shy about is getting some of that financial assistance,
Mhm.
you know, and I go, you know, you worked your entire life, you know, now it's like, let that program work for you. Um,
Yeah, there's
you
no
you should,
harm in just seeing if you're eligible, and Medicare's costs are only going to rise with the premiums and out of pocket. So any help that you can qualify for is much appreciated.
and also having that
Hmm.
safety and security net of having your office help them set up their auto pays
Yeah,
versus relying on a neighbor that could eventually, you know, you're exposing them to your banking information.
right.
So you want to make sure that that is done in an appropriate manner by the appropriate people
Yep.
that can do that. Because
And
I
all
would,
volunteers are like background checked and screened so that you know that you're safe, and they go through HIPAA training for confidentiality and everything.
yeah, and because I had to warn someone the other day. I go, do not provide your social security number
Hmm.
if they ask for it. I go, they don't need it for what you need to do. So just ask them those questions. Do not give their social security number out. You know, so we have to, I kind of had to caution someone about that. Um, and so yeah. So Candace, I really want to thank you, and Jazz, thank you for being here to observe. It was great, and look forward to networking with you guys in the future.
Yeah, see you at the meetings, the
Yeah.
pavia.
Yeah. First Friday of every month.